I'd like to welcome everyone to another Prisma Health Zoom interview opportunity. And thank you for joining us. I'm Rebecca Munnerlin with the Prisma Health Media Relations team. In the United States, 4th of July celebrations often involve large get-togethers of big crowds, bright lights, and lots of fireworks. The holiday can be uniquely stressful for military veterans and others struggling with post-traumatic stress disorder, also known as PTSD, whether it's combat related or not. Today, we welcome a Prisma Health expert for some advice on the challenges facing people who have experienced trauma and may have difficulty around fireworks and crowds, particularly military veterans. I'd like to welcome Dr. Benjamin Griffeth, a Prisma Health psychiatrist and 24-year veteran of the United States Navy. Welcome, Dr. Griffeth.
Thank you.
We're glad to be joined by our local media partners and social media viewers who may join us. And we'd like to invite our local media partners to post questions in the chat, and I'll be happy to moderate those. We'll go through a few questions for Dr. Griffeth, who has talked with us about this topic before, and we really appreciate his expertise. So, Dr. Griffeth, I'll start with, if a person has experienced trauma, does this mean that they have or will develop PTSD? And is this more common for military veterans?
PTSD is actually a relatively uncommon disorder. Trauma is common, whether that's combat trauma for military veterans or trauma in the United States. The most common source of trauma in the United States is actually car crashes. That said, of people who experience trauma, only about 20% go on to develop the symptoms that are considered to be post-traumatic stress disorder. And combat veterans are at no higher risk for developing PTSD than any other people exposed to traumas.
Thank you for that. We tend to celebrate 4th of July in a big way in South Carolina. What challenges can this create for folks with post-traumatic anxiety or PTSD?
For people with PTSD, whether that's combat related or not, there are certain things about the 4th of July that can be challenging. The first is crowds. Crowds can be a source of anxiety, as people who have experienced trauma often want to have everything out in front of them so that they know what's going on. And so the large crowds or being hemmed in by other people can be very uncomfortable. Likewise, surprising noises and surprising flashes can also be problems for people who have PTSD. And so those things in combination, especially around around New Year's Eve or the 4th of July, tend to in combination create a lot of challenges.
How can we support loved ones and be sensitive to those who experience these challenges?
Among the important pieces for loved ones and friends of people who have had trauma in their past or have developed PTSD is to understand that these times can be very trying, and indeed the lead up to and after can sometimes create stress all their own in anticipation of the challenges of 4th of July. And so being understanding and understand that the person who has these issues may be more anxious or more irritable in the days leading up to or during the days of celebration. And as such, give them a little more space, be a little more understanding than usual. Also, be aware that since they have challenges around this, be sure to talk with them about this. Ask how they're doing. Talk to them about the family's plans or your plans around the 4th of July. Ask them if they want to be included, or ask them if they would prefer to avoid those things and even stay home, and give them forbearance. Even if it's a big family event around 4th of July, allow them to stay home if they know that they are going to have too many challenges. Also, if you know that your neighbors sometimes have fireworks, or you're even unclear as to whether they do, inquiring with your neighbors so that you're not surprised even when you stay home by the potential flashes and bangs that go with our celebration of independence. And last but not least, recognize that there are ways to even further your avoidance, the ability to use earplugs or blackout curtains if at home, or some veterans or victims of PTSD, let me rephrase that, or some veterans or people with PTSD will choose to avoid altogether and take the opportunity to camp out or hike or get away from any place where they think that they may be exposed.
Thank you for that. Those are all great suggestions on how folks who experience this type of anxiety can prepare for the extreme sights and sounds of July 4th and similar celebrations, actually. So you really, you went through my fourth question there, right in line. Lastly, I'd like to ask, what are some resources for veterans who believe they may be having difficulty with PTSD or similar anxieties?
Anyone who has been honorably discharged from the military service, whether that's for 1 month or 25 years like me, has the opportunity to enroll and seek care through the Department of Veterans Affairs. And they can do that at any veterans hospital or veterans clinic. Independent of the Department of Veterans Affairs hospitals, there are vet centers in most communities that are federally supported and offer services for veterans and often for their families, often at no charge. Beyond that, you can certainly seek out, and pause while I look off the screen, you can reach out to the Veterans Crisis Hotline at 1-800-273-TALK or the South Carolina HOPES support line at 844-724-6737. Both of these offer services immediately upon the phone call to help veterans, whether that's around the 4th of July or any other day that they seek services.
I've just posted that information in the chat if any of our partners would like to pick it up there. Thank you so much, Dr. Griffith. Do you have, I thought I'd also say that we know that veterans are not the only people who suffer trauma and feelings of anxiety in situations where they're surrounded by big celebrations, crowds, loud noises, things like that. Do you have any special suggestions for folks who may not be necessarily attached to military resources, but any advice for those folks who might need to talk to someone or take similar preparations for July 4th, knowing that that's right around the corner?
For people who struggle with PTSD that are not veterans, often there is community resources available. And so the ability to seek resources in the state of South Carolina through any of the South Carolina community mental health centers is a first good starting spot. They can also seek care through contacting their primary care provider and talking to their primary care provider, or receiving a referral to a therapist or psychiatrist through either their primary care provider or by contacting their insurance company about the same question. There are also a variety of support hotlines, and I do not have them at my fingertips, but once we conclude kind of the live, I can look them up. There are specific hotlines available for people in crisis, whether that is due to the holidays or due to other sources of crisis.
We'd be happy to support any request for that information. I have a couple of questions for you that have come in. One is, if you have, for instance, a family member who is a veteran who is dealing with this type of anxiety, and maybe they've chosen not to participate in a family celebration, or maybe they've chosen to leave town, how might a family member explain that to the children in the family? How do you talk about these things that adults maybe are dealing with children to help them understand and learn to be sensitive to the way folks react to things differently?
Responses to children about the health and sometimes illnesses of adults can be challenging because it varies tremendously based on the age of the child and their understanding of what's going on. Certainly with adolescents, the ability to directly address what illnesses may exist with their loved family member and the way that that shows up in their life can be probably directly addressed. With younger children, it may be appropriate to just say that your loved one has challenges because they have had experiences that make them sometimes more fearful than others, and that these are events that they have learned to stay away from so that they feel healthier and are happier. And most children can understand not wanting to do things that are not fun.
Here's another question. And I think it goes to perhaps someone who may not realize that they could have an adverse reaction when they're already amid a celebration where they thought they were fine, they were looking forward to enjoying it, and then maybe they start experiencing some trouble, feelings of severe anxiety in the moment. Are there ways that we can support someone that we may observe they're in person at an event to help them, and especially somewhere if they can't really immediately, take shelter, if you will, or get away from it? How could we help someone that we observe having trouble?
If you're at an event such as the 4th of July or any other celebration, and you see somebody who's struggling, whether that is due to trauma or trauma-related events that are being sparked by the holiday celebration or any other form of distress, the first thing you want to do is simply ask, how are you? Are you struggling? Are there ways that I can help? Often that person knows what they need and you can assist them with finding the supports that they need. If they don't have those inbuilt coping skills, often assisting the person to sit down or to walk to the edge of what's going on, to inquire as to whether they have friends or family with them who can be of more assistance for them, but ultimately staying with them and helping them as they traverse that period of anxiety, knowing that anxiety does not last forever. It's often time limited, and just the presence of one other person who's caring for them can often be the biggest help you can offer.
Okay, that's great advice. And I've got one more question about, let's see how I can phrase this. This is more of and I'm not sure you want to go here on this, but is there any particular experience maybe where you have been on site or seen someone experiencing PTSD and or other distress around the holidays, and how perhaps that an individual person may have overcome it or just managed in that moment?
Yeah, I don't know that that's for that. I don't know that there's a good answer for that, because I think that though I have had those experiences, they're very individual. There's not an overarching, this is how in general everybody does it. It was very much each individual had their own process of improvement that was facilitated in part through, some of the work that I did as a psychiatrist, but often more work done with their therapist. And I think it's too individual to be able to give a good broad answer.
That makes perfect sense. Thank you so much. It looks like, unless we see any more questions, I'll give y'all a couple more seconds, but I think it looks like we've gone through the questions that we've received. Thank you again. We so appreciate your expertise and insight into this. It comes around every year. It's always a fresh topic when we arrive at the month turning over into July and in the summertime, as folks are celebrating being together outdoors and enjoying all kinds of fun activities. So thank you again. I think we're going to sign off, and if anyone needs some support with getting a good recording of this, reach out to me and I'll be happy to help. Thank you again.